I am Dr. Amit Bhaskar, consultant physician and diabetologist at Bhaskar Clinic, Sundarpur, Varanasi. So I will be discussing some identifying key risk factor of GERD in patient with diabetes. As we know that we are living in the world of diabetic pandemic, and the number of diabetic patient is rising day by day, and we are getting the diabetic patient. In earlier it was elderly patient, mostly they were having a diabetes, but now with the lack of exercise, sedentary lifestyle and stress, we are getting number of cases of diabetes who are young, and young onset diabetes we are seeing on the regular basis nowadays. So in diabetes is a condition where there is an increase in the level of blood sugar, that is called hyperglycemia. And we know that insulin is a key factor hormone that helps us to turn sugar into energy in our body. And there are many multifactorial ominous octet. We know the pathophysiology of diabetes. And the pancreas is the main organ that is located in the abdomen. It either do not produce enough insulin, or sometimes there is a total beta cell exhaustion leading to absolute insulin deficiency, and patient landing up into the hyperglycemia, and there are multiple complications. So GERD, that is gastroesophageal reflux disease, is one of the many complications that is associated with diabetes, apart from micro and macro complication like neuropathy, retinopathy, vasculopathy, diabetic gastroparesis. GERD we now commonly encounter in the patient who are diabetic and having a poor blood glucose control. And the higher risk of GERD in patient with diabetes is often linked to how long they have been diabetic. So longer duration of diabetes in a patient, there are more chances that patient having a high risk of GERD, because as we told that the microvascular complication like autonomic neuropathy leading to nerve damage, and diabetic gastropathy, which involves our gut and stomach, that can develop for a prolonged period of diabetes with poor control. So as a result, people with diabetes have a weakened muscle at the bottom of the food pipe, that is we call it the lower esophageal sphincter, and problem with the movement of food through the stomach that lead to gastric dysmotility, which lead to GERD as compared to those who do not have diabetes. So due to autonomic neuropathy, there is a laxation of, we can say, the lower esophageal sphincter of the food pipe become lax, and there is dysmotility of the gut, so the food particles have a slow propagation of food, and due to the laxity of lower esophageal sphincter, the food content tends to go back and cause the gastroesophageal reflux. Look, many of the patients present complain with the heartburn after having a meal. So another factor is the late diagnosis of diabetes. As we know, when the patient comes to us with the deranged blood sugar, he has already metabolic disturbance for at least 5 years in the cases of type 2 diabetes. So there is a already the some sorts of hyperglycemia, inflammatory changes, and other complication, or we can say side effects of hyperglycemia is occurring throughout the period of before the patient is being diagnosed. So even if the patient is diagnosed after that also, so the diagnosis which are made very late, due to some cases the disease may progress fast and lead to nerve damage, and the disease related to stomach, that is gastropathy, also increases. So diabetes is not the, it's a separate risk factor in the management of GERD, because it reduces the effectiveness of acid suppressing medicine, which are the main therapies of GERD, and also increases the risk of developing disease such as Barrett's esophagus, esophagus or esophageal cancer. So consumption of food that are high in fat or spices and drinks, that is aerated drinks and adulterant drinks, that can cause disturbance in the stomach, such as coffee and tea, also increases the risk of GERD in the diabetic, as they are already have a compromised neuropathy and compromised gut function, dysmotility and autonomic neuropathy and laxation of lower esophageal sphincter of this food pipe. So the best way to managing the risk of developing GRD in diabetes is early diagnosis of diabetes and effectiveness treatment of GRD in diabetes, because the symptoms can be unusual or even absent and the symptoms can be confusing. As I told, the patient have a autonomic neuropathy. So sometimes the symptoms are missed and some cardiac complication also occurs. The patient can say with the heartburn, the cardiac risk can be compromised or can be masked. The patient already having a GERD and having a symptom of ischemic heart disease, and also they present with this heartburn. So there, the serious complication can also be masked with this GERD. So early diagnosis and early treatment. So there are inertia from the patient perspective, and there is an inertia from the healthcare physician also. If the patient having a mildly deranged sugar or in a pre-diabetic range, they tend to prolong the period of medical nutrition therapy, although knowing that there are risk of complication when the sugar is not controlled, because in our Indian setup, the carbohydrate rich diet is very much important. The patient have, and then the meal include having they take, they are high rich in carbohydrate. So there are very less chances that patient of Indian population or MNT land up into the normoglycemic after dietary restriction. So dietary restriction is very vague term, we can say, because many of the patients do not follow the proper dietitian advice, and borderline blood glucose derangement occurs remains throughout the year and ultimately leading to complications. So the best way is to diagnose early and treat as early as possible, so that GARD and gastric dysmotility and gastropathy is properly taken care of. So it is advised to do routine checkup and maintain sugar within the normal range, so that the patient of diabetic can be prevented of GRD, or at all if the patient is having a GRD, that can be symptomatically reduced. Thank you very much for your patient care. Thank you.